Today, we're tackling one of the most common and dreaded injuries out there, ACL tears. Whether you're an athlete hitting the field, a weekend warrior playing a pickup basketball game, or just someone trying to stay active and strong and had a peculiar turn on the slopes, an ACL tear can significantly derail you. What exactly is an ACL tear? Common signs include a sharp, sudden pain right after you feel or hear a popping sound in your knee. Especially if you play soccer, basketball, tennis, ski, those sports that require a lot of lateral movement. And I immediately said to my husband, I think I tore my ACL. I decided at the time not to have my ACL fixed. And the reason for that was, today we're tackling one of the most common and dreaded injuries out there, ACL tears. Whether you're an athlete hitting the field, a weekend warrior playing a pickup basketball game, or just someone trying to stay active and strong and had a peculiar turn on the slopes, an ACL tear can significantly derail you. But here's the good news. Knowing what to look out for, and most importantly, how to prevent these tears, can keep you moving smoothly and strongly into your future. First things first, what exactly is an ACL tear? Your ACL, or your anterior cruciate ligament, is a critical ligament in your knee. Think of it as the stabilizing force that helps your knee handle twisting and turning motions. It is the main ligament responsible for stability, especially during translational and rotational movements. Injuries typically occur during rapid movements. Think landing awkwardly from a jump, sudden twists, quick stops while running, or during a high-impact sports collision. So how do you know if you've torn your ACL? Common signs include a sharp, sudden pain right after you feel or hear a popping sound in your knee. You may also feel some warmth in your knee as well. You may feel the wind knocked out of you, and swelling and instability quickly follow. Many people describe this like their knee might give way under them. It is so common for my patients to say, I felt a pop and my knee swelled up like a grapefruit right then and there. If you ever experience these symptoms, don't just walk it off. It might seem manageable initially. Maybe you think it's just a sprain or strain, but delaying evaluation and treatment can cause more damage. Your knee could become more unstable, increasing the risk of additional injuries, like meniscus tears or even some cartilage damage. Having no ACL increases the risk of a meniscus tear by a significant amount. Studies show that in the setting of a chronic ACL deficiency, the frequency of a meniscus tear increases by 52%, with medial meniscus tears being the most common after lateral meniscus tears. Additionally, the incidence of medial meniscus tears is significantly higher in ACL-deficient knees compared to knees with a healthy ACL. Diagnosing an ACL tear typically involves a physical exam by an orthopedic surgeon. They'll check for swelling, instability, and assess how comfortably you can move your knee. The anterior drawer or Ligament tests are exams your physician may perform on you if you're not too swollen. You'll likely undergo X-rays and MRIs. These are going to first show whether you have bone damage, and an MRI, which will give us a detailed look at your soft tissues. Both of these studies, along with the physical exam, will confirm whether an ACL tear has occurred. Now let's talk treatment, because not every ACL tear is created equal. Many people immediately associate ACL tears with surgery, but that's not always necessary. The decision hinges on several factors, including your age, activity level, and sometimes even the severity of your tear. If you've had a partial tear and had a relatively low-impact lifestyle, non-surgical treatments like physical therapy, knee braces, and strengthening exercises may be the solution for you. Maybe even some platelet-rich plasma to boost that healing. But for many, especially athletes or highly active individuals, surgery becomes crucial to fully restoring that knee function. Especially if you play soccer, basketball, tennis, ski, those sports that require a lot of lateral movement. ACL reconstruction surgery usually involves replacing your damaged ligament with a graft, typically tissue from your own body, like your hamstring tendons or patella tendon, or from a donor, or what we call an allograft tendon. This procedure stabilizes your knee and paired with dedicated physical therapy sets you on the road to recovery. Recovery does take a while though. Even though this is such a common injury and surgery, you spend the first several weeks just working on your range of motion, bending and straightening that leg. That's your entire job. Then the next several months, you'll be working on strengthening by doing isometric exercises. It's about 9 months to 1 full year before you can get back to your sport. Let's address an important question. Can a torn ACL heal itself? Unfortunately, the ACL has such poor blood supply, which makes it really difficult to heal naturally, especially in more severe tears. Without treatment, you're looking at possible chronic instability, increased risk of further knee injuries, and even long-term issues like arthritis. That's why it's critical to consult with an orthopedic surgeon very early on. So how can you prevent an ACL injury in the first place? Here's the empowering part. You can significantly reduce your risk by incorporating targeted exercises into your routine. Work with a physical therapist or sports medicine expert to strengthen your core and leg muscles, particularly your hamstrings. The posterior chain and the quadricep strengthening is very important as well as plyometric exercises. They'll also help you practice proper techniques for jumping, landing, and quick directional changes. Prevention is truly your best protection and is becoming more prevalent in training for young athletes, especially females. Young female athletes are more prone to ACL tears due to a combination of anatomical differences, hormonal fluctuations, and biomechanical factors. Female athletes tend to have a wider pelvis, which can lead to a larger Q angle. That's the angle between the femur and the kneecap, which increases stress on the ACL during movements like landing and pivoting. Hormonal fluctuations, particularly estrogen, can also affect ligamentous laxity, making the ACL more susceptible to injury. Additionally, differences in muscle strength and coordination with females, often having less hamstring and gluteal strength, can contribute to landing positions that place far more strain on the ACL. I love that there's more attention when it comes to research on female athletes and the ACL because we are finding out that oral contraceptives could potentially prevent hormonal fluctuations and thus prevent ACL tears. I want to share with you now my story of tearing my ACL 15 years ago. I tore it while making a really awkward turn on the ski slope. It wasn't anything cool at all. I felt the wind was knocked out of me, and I remember distinctly feeling like there was a pop, a warmth, and my knee got swollen. I got up. My knee did feel unstable, but I did think I could get to the bottom of the slope. So I did ski really gingerly to the bottom of the slope, and I immediately said to my husband, I think I tore my ACL. He didn't believe me. He didn't think it was possible because I was standing on my 2 feet skiing. But as soon as we went into the lodge and he examined it, he's also a spine surgeon, an orthopedic surgeon. And when the medical professional came and also examined it, it was very clear that I had torn my ACL. That night, my knee blew up like a grapefruit. It definitely felt unstable. And over the next couple days, I had a physical exam and an MRI that confirmed I tore my ACL. I decided at the time not to have my ACL fixed. And the reason for that is I don't do a lot of lateral sports. I really enjoyed at the time doing Pilates classes, running, doing spin classes, and I just didn't think that I needed to have my ACL reconstructed, and I did not want to go through rehabilitation for 1 full year. I strengthened my quadriceps, I strengthened my hamstrings, I do a lot of weightlifting now, so I've been able to preserve my knee and not have any other injuries in the knee. And the only time in my life where I felt maybe I should have done that ACL surgery was when I was pregnant, because again, those hormonal fluctuations made my ligaments really loose, and I did have a few instances where my knee gave way. I am concerned about meniscus tears because, as I told you guys earlier, there is an increased risk of meniscus tears, and meniscus tears can lead to arthritis, and that is something you definitely want to prevent if you're able to do that. So I've lived 15 years without an ACL, and I do feel like I've led a fairly active lifestyle. So you definitely need to make that decision for yourself. At the end of the day, understanding ACL tears, their treatments, and especially prevention strategies empowers you to protect your knees and keep moving boldly through life. Remember, resilience isn't about never facing injury. It's about bouncing back stronger and smarter every single time. Thank you for tuning in to the Resilience Factor. If you're ready to build a stronger, longer-lasting body, make sure to subscribe and share this episode with someone who's ready to thrive. You can follow me at Dr. Pamela Mehta for more expert tips on strength, recovery, and orthopedic health. Until next time, stay strong, stay smart, and stay resilient.